Hey everybody, it's Peter. Welcome to this week's video. I'm joined by Joe Paparo. He is the Hospital Services Coordinator for Gift of Life. Gift of Life is our local organ procurement organization, but they just don't service us. They have a really large geographic area that they draw from, and we're going to learn a lot about what the Gift of Life does today. So with that, I'm going to let Joe talk a little bit about the organization and how it is that Crozier works with them each day.
Well, thank you very much for having me, and thank you for your continued dedication to donation and transplantation, and really the continued dedication from really the entire Crozier Health system to donation and transplantation.
Right.
Gift of Life Donor Program is the region's organ procurement organization. We work throughout really the entirety of eastern Pennsylvania, the majority of South Jersey, and the entire state of Delaware, facilitating donation activity. And really, we do a lot of public education, trying to get folks, registered to be an organ donor, trying to dispel myths and misconceptions about the process. We really serve as that kind of link between the hospital where the transplant is going to take place and where the donation takes place for that organ, that life-saving organ to come from.
The area that you control, that's a lot of square mileage. That must easily be 10, 15 million people?
Yeah, it's right around 11.3 million.
Okay, so I'm thinking clearly here.
Yeah.
So of the 11.3, how many are and have committed to donate an organ when their time comes? What percentage?
Not enough.
Okay.
In Pennsylvania, and these are just very rough estimates. In Pennsylvania, it's about 50% of people have that designation on their driver's license.
50. So what's a good number? I know 100% would be great. What would be, in your mind, a number that would make it possible, and we're going to talk about this in a minute, for everyone who is in need of an organ today to at least have a shot at one in a reasonable period of time?
It's hard to say, but what I can tell you is that, we've worked, and obviously this is our area of expertise, we've worked throughout the region for several years doing studies and looking at different aspects of this. And really what we do know is that the majority of people, close to, even 90% of people we've seen in certain studies have actually shown that they would be willing to take a life-saving organ if they needed one, right? And so really it's more so making up that gap of the people that are willing to take a life-saving organ and the people that are willing to give one, right? And we really just want to close that gap as best we can.
And not anybody can donate. I mean, you may not fit and type and match someone who needs one. So you need a lot of people to draw from just to be lucky enough that you are lined up for that moment to be able to give your organ to someone. So it's important that lots of numbers are available so that the few who need it might match up. Let's talk about the number of people at this moment who might need an organ. And if you happen to have a breakdown by organ, it would be great. I think the listening audience would love to understand how many livers, how many kidneys, right? Whatever you can share, I think this would be great to understand.
As a general number, about 108,000 patients in the United States need a life-saving transplant. At Crozier Chester Medical Center itself,
life-saving means that if not,
patients are going to pass away without
within a short period of time.
Yeah, for some of them certainly.
Yes.
For some of them certainly. At Crozier Chester Medical Center, we have over 200 patients that are waiting for a life-saving kidney transplant. And at the Gift of Life service area alone, eastern Pennsylvania, South Jersey, and Delaware, we have about 5,100 people who need that life-saving gift. And just to show you really how rare that is, and really how rare the opportunity for donation is, Gift of Life has led the nation in a lot of donation categories throughout the years. And last year we coordinated about 1,600 organ transplants. That was among the most in the United States.
Wow.
Right? So we're coordinating some of the most transplants in the United States, but still we have 5,100 people who need that life-saving gift. So it's a huge gap that, again, like the gap in folks on their driver's license, we're always trying to make up.
COVID hasn't affected the need, has it? The need is probably right where it was pre-COVID, but the number of people lining up to potentially donate, I'm sure has decreased. everything has changed in terms of people doing things that they used to do pre-COVID.
It's been challenging. Right? I mean, one thing that's been challenging about it, I know for some of our transplant coordinators, is that, they have just had a much more difficult time, having those conversations with families, because some of those families aren't, able to come into the hospital with the same frequency in the past
Right.
year. But we also do find that really this is one of the most generous regions in the
Why
United
is that?
States.
Why is that? Any
think-
sense?
well,
Because you've been with the organization how long now?
almost 5 years.
So 5 years. You get a chance to see and interact with your counterparts in other parts of the country?
Not necessarily.
Okay.
But I think it partially has to do with the transplant network that is here. There's 15 transplant centers, all of them doing
Lots of
amazing
trauma
work.
centers here,
Yeah.
right? That's
Closure
a
doing
place,
that work
right?
as well. So with all of that knowledge and that expertise comes that responsibility for advocacy as well.
So our processes for recovering organs is probably not only in more locations than most regions, right? We have lots of very sophisticated medical centers in and around the Delaware Valley. But what you're also telling me is that there are a lot of people lining up to donate here because one almost encourages the other,
It does. I
right?
think
And
so.
the more stories we have that prove how beautiful this is, the more people who get exposed to the notion of doing this. And I think I shared a story about a friend of mine
Yeah.
before we shot the video. And these are the sorts of things that you just never forget,
Right.
right?
Yeah.
How somebody helped someone else. And I can't imagine doing anything more to give to another human being than actually taking a part of your body and allowing someone else to live a full life.
Yeah. It's
beautiful.
I wholeheartedly agree. And you have your own connection to donation as well.
Yeah. And not that I donated anything yet, but I got to tell you, I just got my driver's license here in the state, and they asked me, would you? I said, of course. I don't know any reason why I wouldn't, but my stepson, when I met him, he was 5. He was receiving transfusions every other week. He was very skinny, and he wasn't developing the way he could or should. And when he was, if I'm not mistaken, 7, my wife's going to kill me for not remembering this. It's been 5 years, a little over 5 years now, so I'm doing the math right in my head. He had a bone marrow transplant. We have no idea who donated the bone marrow. I understand it's a painful procedure to donate bone marrow. I think they go into your hip to grab it. It's not solid organ. This is a non-solid organ donation. And at CHOP, where he had the transplant essentially occur, his bone marrow had to be destroyed through chemotherapy over a course of 7 days. And on the 8th day, this little bag comes in. It's bone marrow, and it's an IV drip. And that was the transplant. Over a course of several hours, he had his transplant. And that's when the work began, because at that point, he's building a brand new bone marrow in his body. It's a miracle what took place. And for the next 6 months, he had to live in isolation because his immune system had to reestablish itself. And today, he's running around doing all sorts of things. He almost never gets sick. I think whoever donated it, I think, was probably like a Navy SEAL, because his life and the way he lives today is infinitely better than the life that he used to live.
It shows how important it is.
Yes,
really
it is.
It doesn't really matter necessarily, what gift someone is giving. It still, can be have an amazing impact on individuals. I mean, even like tissue donation, which is a lot less talked about than organ donation.
Right.
I mean, folks can give the gift of cornea donation, which is the thin outer covering of one's eye for someone who needs a cornea transplant. Bone grafts, skin grafts for different types of reconstructive surgeries. Skin grafts that are used in the burn center, Crozer Chester Medical Center. So, some of these gifts are very, important and very, to me, underrated. Compared to some of the organ.
You don't have to be in perfect health,
No,
right,
absolutely
to
not.
donate, right?
Absolutely.
Why don't we talk a little bit about those processes? How is it that you actually vet the donor, the organ itself, the whole matching procedure? That's all pretty cool stuff. To think that you can take something out of it's not that easy, right?
It's a challenge, and it's case by case, of course. But what we're really looking at is the patients on the waiting list every day, right? When people are thinking about signing up and registering to be an organ donor, they might think to themselves, I'm too old or I'm too sick to be able to donate, right? But there are some patients, maybe at Crozer, maybe in Philadelphia, who are going to pass away today without that life-saving gift. So for that individual who is at risk of passing away because they're not going to get that transplant, they could, an 80-year-old liver is going to be just fine for that person. You know, it could be, or you know, a kidney that may come from someone who's a little bit older, or you know, just because someone has one organ that might not be working to the best of its ability, that doesn't mean they wouldn't be able to donate something else. You know, maybe they might say, oh, I have hepatitis C, right? That doesn't disqualify anybody from being a donor. Maybe someone with asthma might not be able to donate their lungs all the time, but they could still donate their liver or their kidneys. So we're really looking at each patient, you know, what is the maximum potential that they may be able to give to somebody else, and really, you know, matching that along with the need in the community and who's on the list that day.
So we've established earlier in this discussion that there are over 5,000 people waiting for organs, right?
Yeah.
And that in a good year, you're able to coordinate about 1,600.
Yeah, I mean, it was greater in 2019,
right?
Just before the pandemic, we had coordinated a greater number.
Okay.
But
so
again,
is the right
a huge gap?
Yeah, is the way to narrow that gap by just getting more folks to agree to donate? Is that the answer?
I think it's a lot of it, certainly. And really, that's a lot of what National Donate Life Month is about: encouraging, you know, participation and really registering as many folks as we possibly can to be organ donors, and really encouraging families to have those conversations about, you know, what you would want in an end of life situation, and really, you know, making sure that commitment is you know, known throughout one's family.
Right.
But you know, we're also doing other things to expand the pool of potential donors as well. You know, I mean, some of the amazing, you know, medical technologies that are going on right now, and some of the amazing transplants that are happening right now is also an important part of it. But getting folks registered is a really
so. Besides this video, what else can Crozier do? Can the community do to get behind this cause? Because it's as noble a cause as you're going to find anywhere, right? It's to give somebody a new lease on life.
Absolutely.
Right? What can we do?
The best thing that you can do is you can go to donors1.org to register to be an organ donor, and to encourage your family and friends to do the same. Something interesting that we're finding right now is with COVID, less folks are going to the DMV to actually put that on their driver's license. So we encourage anyone who wants to sign up to be a donor to go to donors1.org. Gift of Life is also doing a number of activities in the community, especially our Dash from Home this year. So every year at the Art Museum in April, we do our donor dash. We have, you know, thousands of people come down to run the 10K. This year, unfortunately, we're not able to gather for that, but we are doing this Dash from Home program where folks between April 10th and April 18th can don their donor dash gear and raise money to support donation and transplantation. We have a whole week. It's called a Spirit Week, where we're doing all these different activities online and raising awareness. So we encourage everyone to go to donors1.org to look for those activities and share that experience with your family and friends. Last year, before the world shut down from COVID, we actually did a dunk tank. Where the transplant surgeons were,
I saw that. I was here just for a little while. I know Sonny Fink got in there.
It was like the second week of March. It was freezing out, and you know, it was a fun time. Crozier Health, again, has an outstanding commitment to donation and transplantation. Obviously, the transplant, you know, center, we talked about that. We talked about the great need for kidneys, really, for you know, the community that Crozier serves. But really, on the end of the potential donor, there's a lot of great work that's being done as well, and from the various ICU leaders, really throughout the entire system, from the, you know, the nurse educators, from you know, some of the attending physicians, the GNI team over at Crozier Chester Medical Center have all done a fantastic job in supporting the donation process. And really, their support has not only led to a lot of, you know, organs that have been eligible to be transplanted, but Crozier Chester has also received recognition from the Hospital Association of Pennsylvania Southeast Connect for their outstanding commitment to the donation process as well. So it's great work being done.
As you were speaking, I was thinking about something I heard a motivational speaker say once about being lucky, and that lucky is really not so much about being lucky. It's about being prepared when the opportunity presents itself. And I think because we have systems in place and desire to help, we do a pretty good job of recovering organs here. And it's because of the wonderful staff, the surgeons, and our processes that have been fine-tuned over years to do I think one of the coolest things you can do with your own life is to help someone else the way we do.
Yeah, I absolutely
And the way you
agree.
coordinated throughout the region. It's beautiful.
Yeah, and it speaks to not only the commitment of the healthcare teams, but the generosity of our communities.
Yeah.
Absolutely. So I brought for you today a Donate Life bracelet and pin.
Thank you.
Thank you for having me.
I mean, I will. I've got one bracelet on now. It's a Crozier Health. Be well, do good. I'm going to be wearing 2 now going forward. And as always, do what you're doing. Be well, do good. Delco is counting on all of us.